Dr. Shamas' daughter uses technology to help her monitor and dose her insulin, but she still has all the manual supplies, including syringes, monitoring equipment, and vials in her emergency kit. Why? Because technology fails. And in a disaster situation, knowing how to manually dose that insulin may just save her life. Today, Dr. Shamas talks to us about what is important to have in every diabetic emergency kit. This is great information.
Hey, Provident Preppers, I'm Kylene.
And I'm Jonathan, and we are excited to be with Dr. Julie Shamas again. And today we're talking about another very important aspect of our preparedness, particularly for those who are diabetic or who live with diabetics, are around them. We're talking about a complete diabetic emergency kit, and no one better to talk to us about that than Dr. Shamas. So tell us a little bit about, again, yourself, a little introduction, and let's jump into this.
Thank you so much for that introduction. You guys are the best. Just can't tell you how much I love watching your channel and following along. You've taught me so much. So this little area, maybe I can offer some insight. So I'm Dr. Julie Shamas. I am an emergency physician. I've been a physician for more than 20 years. I'm also the mom of a diabetic child and the aunt of two other diabetic children. So we're pretty savvy on all of this around here. We're very interested in preparedness, and we're very interested in taking care of our family. And I like to think, if you're the parent or the family member of a diabetic, especially if you're a parent of a diabetic, we talk about preparedness in terms of the big, exciting, oh my goodness, emergencies, but we live with emergencies every day. I mean, I probably wake up 3 or 4 nights a week because my daughter's sugar is dropping and I have to jump out of bed and go deal with it. Like, we live that sort of emergency awareness all the time. It's a small emergency for us. It's a personal emergency that her sugar could drop, but it's a big emergency because it can be life-threatening. And it's something that we have to be aware of in every aspect of our life all the time, in our family, in our extended families, and the teachers. And like, it's a community problem. It's a community level problem. Everyone has to be aware all the time. And we have to go to great lengths to make sure that we are always ready to deal with a crisis.
Now this is the third video that we've done with Dr. Shamas. And in the first one, she talks about surviving these hurricanes and different things that she learned about dealing with this. And then the next one was all about preparing the food. And so this time we're going to specifically focus on medically what we need to do to make sure that we can take care of those that we love and that they can survive these events. So you've got this all figured out. Teach us.
I don't know if I have it all figured out, but we have a little experience with this. And so, and I want to share one thing. So again, my daughter was diagnosed with diabetes. I guess it's been 5 years now, but I've been a physician a lot longer than that. And I spent years as an emergency physician, which means I take care of people coming in crisis. Sort of the definition of what I do is crisis management, right? Like that is the definition of emergency management. And I've counseled patients for years about their diabetes who've come in with very low sugars, very high sugars, very, very sick, sometimes dying, right? And I will tell you that when my daughter was diagnosed, and suddenly I'm on the other side, I'm playing for the other team now, right? Like, now I'm on the family side. What was so obvious to me is we do a really, really, really bad job as a medical community educating on diabetes. And I want to sort of put this out there as we go into this, to say that as a diabetic, you need to advocate for yourself. It is, especially on the adult level. With the children, it's a little different. If you're diagnosed as a child, the children's hospitals are better about making sure that the families know what to do and that they have all the equipment and all the things and all the teaching and the nutrition and like all the cool stuff. But adults, we do a really, really fair to middling and worse job. And I know this because I had so many patients come who didn't know what they were doing. They just flat out, the educational system that we have and our hospital system that we have, it sort of at times fails these patients. So what I want you to know, and this is not medical advice, your diabetes should be between you and your doctor. But what you need to do is advocate for yourself. When you go into the doctor and you're trying to figure out how to manage your diabetes, you need to say, I don't understand. I don't understand. What do you mean eat a healthy diabetic diet? What the heck is that? Like, what am I supposed to do? I don't understand. And understand that the way our current system is designed, they're not going to sit there for an hour and teach you how to eat healthy. Like, that's not where a doctor's office comes into play. You might get a nutrition consult, and that's something you should do. There are a lot of really great YouTube channels and other places you can get good information, but make sure it's good information, because I will tell you, there's a lot of bad information out there. So as you begin to think about how you're going to handle your emergency preparedness, not just for the big exciting things, but in the everyday things, make sure that you have empowered yourself with the knowledge you need to handle your personal diabetes, your personal disease. Make sure you understand what you should be eating, how you should be eating, how you should be doing your carb ratios. And if you don't know, sit down with your doctor and ask the questions. And there's nothing wrong with saying, I need to come down and sit with you and have you write this all down because I don't understand. They will make time for you, but it will never happen if you don't advocate for yourself, because it's just the nature of our system. I wish I could say that wasn't true. And a lot of times it doesn't happen until a crisis occurs. So the patient comes to see me in the ER because really bad things have happened because that didn't happen ahead of time, right? So emergency preparedness is not just about the sky is falling. It's I passed out in the bus because I didn't eat right and my sugar bottomed down and now I'm in the ER. That's an emergency, right? Like it's a personal emergency, but it's not a hurricane that's coming, right? It's your little emergency, but those emergencies can kill you. So advocate for yourself, talk to your physician, join a really good diabetic group, awareness group, learn, just like we learned from you guys about this topic, find a trusted channel and please make sure it's a trusted channel. There's a lot of very dangerous misinformation out there. Just because Joe Bob says that they can manage their sugar a certain way doesn't mean that that is for you. So get good information. And the first part, I think, of preparedness for diabetes is like we will say about anything, it's education, right? Knowing what you need to know to keep yourself healthy, safe, how to take your medicines, what your backup plans for your medicines are. Like long before you start talking about where to keep things and what cool, nifty toys to store away, you need to understand your disease process. And unfortunately, and I know this very personally, it's not going to magically go away. There's no magic bullet. There's no herbal remedy. Like maybe if you're very lucky and you're a diabetic who is diabetic because you're particularly overweight and you can lose some weight and maybe that will help you. But for the majority of our population that is diabetic, this is your cross to bear. This is something that you're going to have with you for a long time, especially for the kids. Short of genetic research and a cure along that. And listen, I pray every day that in the next 10 to 20 years we have a cure for diabetes. Like I'm seeing amazing things happening with CRISPR and other genetic research that's unbelievable with other diseases in children. And I am so hopeful that in my daughter's lifetime that we will have, if not a cure, something that just really, really helps her. But for now, as I've told you before, she's my bionic kid and she has external equipment to let her live a normal, healthy life. Like that's the thing. You can live that healthy life, but you can't pray it away. You can't pretend it away. It's going to be there. And the only thing you can do, and you should do, first and foremost, is educate yourself and have those conversations with your family and your doctors so you really understand what you need to do to keep yourself well, and that your friends and loved ones understand what to do to keep yourself well. Now, that's my soapbox of the moment. When I think about my daughter and my two nieces, all three of them have diabetes, which I should tell you as a side note, nobody in my family had diabetes before this. So this is all first generation. So it's new for us too. And so just because you say, oh, my family doesn't have diabetes, you never know. And you may have a good friend and you may have someone else in your life that this is relevant to. So again, the more you know, right, the more you can help others. So this is something I think that even if you're not a diabetic, being able to help your office worker or your friend or someone in church or wherever when they get hot and woozy and they're falling down on the ground and you go, I see a diabetic bracelet on them. Being empowered with that information is really, really, really valuable. For a diabetic, the potential for an emergency every day exists. And I don't, again, mean that the hurricane's coming and houses are falling down, but I mean for their personal health every single day. Multiple times a week, I am up because my daughter's blood sugar is dropping. It's 3 o'clock in the morning and we are dragging ourselves out of bed because she sleeps through her alarms like every other teenager on the planet. And so we have to go in there and wake her up and give her her medicine and give her some sugar and do all the things. That is an everyday thing. So before we get to the everyday carries and all that, you really have to think about, well, what do I need just in my everyday life to keep those daily emergencies going? So you need to make sure in your own home that you understand where all of your glucose, your diabetic test kits are, where your emergency sugar is, whether it's pills or we've talked before about the little Smarties. My husband in his robe, when he gets out of bed, the pockets of his robe are filled with this all the time, like just so that he has them when he kind of groggily stumbles out of bed. They're there all the time. That you know where your kit is, you know where your backup kit is, because sometimes your kit doesn't work. Sometimes your kit doesn't have all the things in it. That's just your everyday in the house. Know where your insulin is, know when your refills are due so that you don't run out of your medications, all of those sorts of things. Okay, so that's in your home. That's every day. Where are you keeping your insulin? What if you have all your insulin in one fridge and the fridge dies? It's not a power outage, your fridge just dies because these things happen, right? So consider maybe splitting your insulin into 2 different locations. Have it in an inside fridge, maybe in an outside fridge, maybe you have a little cooler fridge. Like we have a couple different ones that we use. This actually almost happened the other day. The fridge we keep most of our insulin in has a temperature control, and something had happened where the temperature control got screwed and like it turned it way up, not hot, but enough that I went in and was like, what's going on here? But that could have been a real crisis because we had a lot of insulin in that fridge. And insulin's not cheap. I mean, even getting subsidized insulin is not cheap. And forget insulin for a second. So all your insulin dependent diabetics will appreciate it. So insulin itself, if you pay retail for a vial, like not insurance, you can get a vial of insulin for $35. It's my bionic kid, right? So she's on Dexcom and Omnipod. And I'm gonna get these wrong, but the Dexcom's, this box, which has, I think, one sensor in it, it's about $100 to $120. And this box, if you pay retail, is about $500 for 5 of her dispensers, depending on where you get them. So losing your equipment and not having it, very expensive. Now, if you have insurance, it will pay for some of this stuff. But again, as we talked before, when you have insurance, it's that just-in-time supply chain that we talk about, like for groceries and stuff, like you have just enough to get to the next one. But when there's an emergency, just enough isn't enough. And unfortunately, paying for these things can be difficult. There are ways to prepare for that. So if you're a bionic kid, right, or a bionic adult, and you have your Omnipod or whatever system you use to give yourself insulin, right, you can still have, in addition, your doctor will do this, rescue pen. So this pen also has insulin in it. So for something that happens here, you can also have this, and your insurance will pay for both. So this is backup insulin covered by your insurance because you need your rescue pen if you have a failure of your system. And that's the other thing you have to know. These systems, they're fantastic. They do amazing things and they fail all the time. It is so common. Like just to change out one, you might go through 3 or 4 before you can get the one on. So it's a very common thing. So having your backup just as part of your normal everyday preparedness is a good idea. Having some extra vials, talking to your doctor, and having extra insulin in whatever fashion is a great idea. Same thing if you're on pills and not insulin, make sure you have enough pills to get you through a crisis. And I think most physicians would be willing to give you some extra supply for a truly life-threatening, even if it's doing a 90-day supply instead of a 30-day supply. There are ways that you can have conversations with your doctor to be safe and make sure that you never run out of what is essentially a life-saving medication, okay? All right, so make sure you have all your stuff. Make sure, and I'm not going to open it this time, but make sure you have your test kit with all of the things you need, your lancets and your test strips, and that you have extra. Same thing, it's great to have your pen, but you have to have needles to go with your pen. So if you have your rescue pen in your purse and you forgot to bring your needles, you're sort of up a creek without a paddle. So you want to make sure you have all of your stuff. I'm working on making a list right now for my daughter who tends to forget things, and just sort of having the, okay, I'm leaving the house, just going to the store, but I need to make sure in my purse I have all of these things at all the time, and just a little list. This is essentially the everyday carry for a diabetic, right? You need your whatever gear you're wearing attached to your body. You need your extra pen, your insulin pen. You shouldn't leave the house without it, because your system can fail, your phone can fail, the system itself can fail. You can run out of insulin. Can I tell you how often these things, like it's so common. It's not even an emergency. Like, it happens at least every couple days, something happens. So you always want to have as your purse, bag, everyday carry, aside from all the fun stuff, we could talk about that. As a diabetic, you want your pen, you want the needles for the pen, you want your kit, you need to have your rescue for when you get low, right? So you want to have some sort of sugar. We like Smarties because they're easy. I've talked about this before, especially with kids. If you know that a Smartie has 6 carbs, and since they're broken into little tiny pieces, you can literally figure out, well, okay, so this many is 3 carbs, this many is 1.5 carbs. It's very easy to dose exactly how much sugar you need. If you need extra, more long-acting food and carbohydrate in you because you got really low, which happened, something like the Ritz crackers are great. They make these in packs of 4 instead of 6, so they look sort of like this, right? And I love those because one of the things that can happen with a diabetic when they drop really low is people are like shoving food at them. Oh, you gotta eat, you gotta eat, you gotta eat. And you overshoot. Boy, can you like really overshoot. And so one of the reasons I like the 4 packs instead of the 6 packs is I think that it keeps you from doing too many. Now you may need more, and so you'll open a new pack, but I think that the mentality is there that you don't go, well, I've opened the container and I have to eat them all now, which is a very common thing. But you need to have something in there to help bring those sugars up. I've been at the theater with my daughter, or places that you're just out doing something and all of a sudden she's dropping and there's just no food to be had. So you always need to have these things. They go in your purse. They go in mom's purse, or in my case, it's a backpack that I keep with me as a physician all the time. They go in every car we own has a diabetic kit in it, like the same stuff, because teenagers forget things at home, right? Like, can I keep an insulin syringe in every one of them? No. So, we try to do that. And insulin is sensitive to heat. So sitting in a car can be difficult, but all the other stuff, like the snacks, the kit, like I've got them everywhere. They're in every car. They're in every backpack. They're in every go bag. They're in every bob bag. Like any bag that you're putting together as a prepper needs to have this stuff in there. And not just for the person who's diabetic. Like we have, like my daughter has it, but I have one in my bag too, because what if she's lost her bag, or what if she's forgotten and it didn't get fixed in time, like all those things. So everything we're going to talk about, at least the basic kit, we have it lots of places. As far as getting extra kits, you can ask your physician for prescriptions. Sometimes the drug companies will give them to you. I am a big fan of having the same type of kit everywhere, instead of like, oh, Aunt Sally gave me this brand and I have, I like having it all the same, because the strips are different for every kit and I like consistency. So if I find that this kit died, but this kit has strips, but the rest of the kit is like, I can cross react them. So I think that
makes a lot of sense.
Yeah. So redundancy of everything being the same. That being said, we want the same sort of things in the cars, in your backpack, in your purse, in your go bag, in your get home bag, everywhere you need to go. That's pretty simple. That's not horribly expensive stuff. It's very easy to maintain, and make sure it's in, like if you and your husband have a car, make sure it's in both cars. So you never know who's driving or what's going on. Most diabetics also have a travel bag. Often it's a little refrigerated bag, like way back when we used a little refrigerated, not refrigerated, like a insulated lunchbox, like the soft-sided insulated lunch boxes. And again, so we would travel and we'd be on a plane, or we would, my daughter was younger, and you would keep all this same stuff in there, but then you'd have additional snacks, and you could put a little ice pack in there to keep the insulin cold while you flew off to see Aunt Susie, like whatever you're going to do. So that's sort of that next level. And one thing that people sometimes will worry about in terms of preparedness is, can I travel and take them on planes? Can I go through security measures? Yes, absolutely. But remember, you have to have some see-through bags, or you're going to have to open everything up. Now, insulin, since it has to be kept cold, you can have it in an insulated bag that isn't see-through. It's an exception, but you may have to pull that out in a line and show that through security. Just, you want to keep that stuff where you can get to it easily. Don't put it up way high when you're traveling up in the carry-on space above your head on an airplane. If you're getting low and you need something really fast, you don't want to have to get out of your seat and go get those. So it should be in the bag, like at your feet. So you think about those sorts of things. We have talked before about broader preparedness. I know you have a video about putting together a bucket with food and water and all the information that you need. And I should add into that, one thing you should also keep everywhere is a list of all your medications, maybe photocopies of your prescriptions and emergency numbers, as well as diabetic bracelets. Like, those are the type of thing that you want to have handy. So same place, you kind of distribute that. But now let's say something really is going on and we need to get out of the house quickly, not so quickly, depending on the nature of your emergency. If you're the type of person that is like in a wildfire zone and you need to be able to leave really, really fast, you need to have everything staged and ready to grab. We're not wildfire people, we're hurricane people. So our disasters sort of meander their way up to us, but it's still something that you have to think and prep about. And the idea is the same. And it's all about thinking ahead and staging what you need, where you need it, so it can be grabbed quickly. Because unlike other types of preparedness where we make cool kits and cool bags and we can sit them to the side and like not touch them for a couple of years, not true with diabetes, right? Because insulin is refrigerated, and that changes the game. So one of the first kind of purchases that we made when we started thinking about our daughter and to change how we prepared was we started to invest in ways to keep things cool for a longer term. Especially in Florida, power can go out for hurricane for a long period. Long before we had solar on our roof, we had to have a way to do this in the short term. And so we talk about the easy and inexpensive way, sort of the middle ground way, and then the kind of the advanced masterclass. And I know Jonathan's an advanced masterclass kind of person. So, but they're in the farther towards the masterclass you go, the more money these things cost, and not everybody can do that. So, and again, remember how expensive these medicines are. A lot of people who are diabetic are already spending a lot of money on their medicine and may not have as much disposable income. So let's start with the basic. So the basic version is you've got all of your insulin in one or two places, maybe one or two fridges, or however you're doing. Maybe you keep some of your insulin at your grandma's house. Like maybe you've spread it around so you don't have a fridge, go out and lose all your insulin. Whatever you do, you can keep, like I said, a little, soft-sided or igloo cooler kind of lunchbox nearby, like right there. If you're dealing with your fridge, keep ice packs. Again, I'm talking about the school lunchbox size in your freezer, and like a little pocket of your freezer all the time. So they're ready to go, right? So when it comes time to grab and go, and I highly recommend putting a list on the edge of your fridge. We actually don't have in the fridge. I have like a get out the door packet that we have somewhere else. That's grab these things in this order of priority, right? And you may not get to the bottom of that list, but at least, the first thing is insulin, right? Like this is what we do. But have it written down, because when you're running out that door and there's something bad happening and you're stressed and you're trying to figure out where the car keys is and did you get the dog and the cat's trying to scratch your eyes out, like whatever crisis you're dealing with, right? When you have those things written down, especially when it comes to your diabetic stuff, it will really help you. So have it written down, put it on your fridge, put it wherever you're going to put it. And just like as a check mark, I got the insulin, I got the little insulated cooler, I've got snacks, I've got my test kit, I've got my pen, I've got everything I need, ice packs, and throw it all into that cooler and get one bigger than you need. Just stick it on top of your fridge or wherever you're going to put it. So you don't have to think, just shove it all in there. And there's plenty, things aren't falling out all over the place. It'll all fit in there. And that'll get you out the door. Okay. So that's the cheap and easy. I mean, you can get one of these little coolers for free. Some kids always giving one away. I had so many of them from when the kids were little, but just grab what you need so that it can go. And then you get out of the house, you go wherever you are going. That will, if you have an ice pack in there, you're good for like 6 to 8 hours. Don't be opening it all the time, but like once it's in there and closed, it'll stay cold or cold enough, long enough to get you somewhere else. And if you have to stop and get some ice and put it in a bag, like you've got hours and hours to get to a point where you have power and refrigeration and safety and all the things. And remember too, not optimal, insulin when it comes out of the fridge and comes to room temperature is still good for 30 days. Okay. Now, if you're grabbing 6 months worth of insulin, you don't want all that stuff to come to room temperature because that's a lot of money, right? So you want to keep as much as possible. But if you've just got a little bit and you're like, oh, it got warm, it's okay. Like that's going to be okay. It'll still give you 30 days of insulin. Make sure you've got your syringes, everything in one place. In fact, if you want, in that little container that you're going to throw everything into, keep everything but the insulin and the frozen bags in there ready to go. So it's just a stage. You grab everything you need and then throw in the insulin and throw in the ice packs and you're out the door in 20 seconds. Like that is an important way to handle it. Version 2 is like the next stage up. So, and I should have grabbed one, but let's say you have like a little Jackery or a little EcoFlow, one of these solar battery generators, and literally like they can be this big. You can get ones that are bigger, but you can have the little tiny ones. Just something that's going to give you some power for a little while. Add that to one of these battery-driven refrigerators. Bodega Cooler makes them. GoSun makes them. There are a couple companies out there that make some really good products. We have several of them. The ones we have are more the size of like a big igloo cooler that you put in your back of your truck when you're out, at the game or something like that, that normally would be full of ice. Instead of being filled with ice, they actually run off of a battery and you can set the temperature just like a fridge and they will run for many, many hours and you can hot swap the batteries out. So you can have several batteries charged and ready to go. You can actually connect the cooler itself to a solar panel, like a portable solar panel, or you can like take the batteries that are extra and have them connected. But you could cycle through this and have all by itself, if you have this little cooler-like thing, a couple batteries and a panel, you could keep yourself with power for just the insulin for a very long time, like weeks. If that's the only thing you're trying to keep cool, we're not trying to run the air conditioner in the house. If you're just trying to keep the insulin cool, and they make them as small as like, I don't know, maybe 15 inches by 15 inches. I have a smaller version that kind of go between the consoles in a car to the bigger ones. And it just depends on what you want to use. Same idea.
Yeah.
You're still going to grab all your stuff and throw it in there and go. And the advantage of this is you throw a couple drinks in there too, and it will stay cool longer. And if you're in a car and going for a long drive, for example, you get stuck on the highway trying to leave for a hurricane while you're driving to Georgia, and it's going to be 16 hours to do a 6-hour drive, because this really happens very often. The advantage to these is that you can actually plug them in to like the car lighter connector. And so now it stays cold, right? You don't have to worry about a battery. It's running off the car. So that's option 2. Option 3 is to go big or go home, right? Like now you're talking about having a solar roof or something that's going to maintain power for long periods of time. You're doing something where you never have to worry about loss of power to your insulin. Now you may still have to leave, but if you're staying in your home for the disaster or whatever is going on, you don't have to worry about supplying power to it. You've got a solar roof. You've got other options that will keep everything cold. That's a big scale. I think most people, and we started with just that little cool, like the little lunchbox kind of cooler, and it worked just fine.
One random question. How long can you store insulin? Do we have a year shelf life on it? I know there's probably a recommended and then an actual shelf life, but if it stays cool, what's the shelf life?
Okay, this is not medical advice. Let me start with that. However, contrary to what is sort of public opinion, most medicines will last much longer than their stated best by date. Now, you should discuss that with your doctor. You should discuss that with someone who's actually knowledgeable about that, which may not be every doctor, but most medicines will last a really long time. Your Tylenol or your Motrin at the end of a year does not need to be tossed. It's going to be just fine. However, there are a few medicines that they should be tossed, and insulin is one of them. And this is one of the problems. So tetracycline becomes dangerous with time, and nitroglycerin, which a lot of people also have to wear, ages and will not be as efficacious, and you don't know how good or not good it is. So it's another one that you don't want to do. But insulin, this is the problem with insulin. Insulin is good in the refrigerator for a year, at which point it is still good, but we don't know how good, meaning it begins to lose efficacy. And when things have to be precise, so let's say you're carving it out and giving yourself enough insulin, but that insulin's only 75% of what it was, you're losing out on 25% of what you need. And that can be detrimental very, very fast. And so no, insulin, unfortunately, I would never utilize, short of end of the world scenarios, I would not utilize old insulin. At the end of a year, it's time to get new insulin to replace it. It's one of very few medicines where that is true. Now, when you take it out of the refrigerator, it's good for 30 days. And then again, after that 30 days, you don't know how good it is anymore. So can I tell you how many times I found insulin pens without a date on them sitting in a random purse from my daughter? And I don't know. And unfortunately, because I don't know, I can't use them. So that, which raises a good point. One thing that's very important to do, and don't trust the teenager to do this. My daughter is brilliant. She's really, really good at a lot of things, but she's a teenager. And this is one of those things, is when you take an insulin pen out, take a Sharpie marker and write the date. And this should be true for any vial or anything of insulin that you're using. Just write the date on it that you pulled it out of the fridge, so that when you find that vial hidden behind something in the kitchen, or you find that pen in the purse, you know it's only 2 weeks old or it's 8 weeks old, and which one is it, and is it still safe to use? And unfortunately, we are guessing a lot of the time, and we end up throwing a good bit away.
What if it gets frozen?
I don't have a good question to that. Insulin should not be frozen. This is, I can't tell you definitively because I haven't done the research, but I will tell you insulin should not be frozen. And I personally would not use frozen insulin because I don't know safety. And more importantly, when you talk about freezing, is you talk about, not more importantly, but equally important, when you freeze vials, weird things happen to the vial, like they can break. Like, it's not, we don't tend to freeze those medications. They're refrigerated and they have a very set temperature they're supposed to be kept at in a fridge. But I have never looked at frozen insulin. And so let me start with, insulin is not safe to freeze. And let me just leave it at that. Insulin should not be frozen. So we're trying to get out the door quickly. You know, somebody's grabbing the dog, somebody's grabbing the cat, somebody's grabbing the insulin, and all the fixings that go with, which we've already discussed. So that kit is ready to go, and we've got your insulin. Now, you are going to grab the things to keep it cold. So maybe you have that cooler, maybe you have the little mini fridge, whatever you're going to use. But you got to grab the other stuff too, and you can't just grab the usual snackies, rice and beans, like we've talked about. You know, whatever. You need very specific things that will be edible and not drive your sugars through the roof. So that's where putting together the kit comes in. And we've talked about making sure there's adequate water in there, making sure that the food is in there is good choices for a diabetic, meaning high protein, low carb foods. And I know we've done another talk on that, going at length into that, but things like high proteins, eggs, jerkies, those sorts of snacks, you know, cheese, crisp kind of snacks that are going to be protein. But again, let's not forget that if your sugar goes low, you've still got to have in that same kit your rescue food. So you want to have your Ritz crackers, you want to have your Smarties, and those sorts of things. Everything should be in there. And the kit itself should also have a redundancy of all of your equipment so that if something fails, you've got another kit, you've got all of your lancets, you've got your strips, you've got your needles, all of that stuff in one place, as well as some hygiene items to keep you healthy through this process, and a first aid kit. And I should add that as a diabetic, everybody should have it, specifically as a diabetic, having that first aid kit, again, in your cars, in your get home bag, in your purse, even if it's just a little tiny one with some Band-Aids, because you check your sugar and your finger's bleeding. Like, you need to have that basic first aid kit sort of all over the place, and maybe expand on it when you think about like what you're keeping in your car. Ours is a little different. We were laughing as we sat down. There are first aid kits and there's first aid kits, right? So it may be something. I've seen people just do those little tiny Band-Aid boxes and then have a lot of other little things in there. As a diabetic, you're going to need more than that, right? So those kits that are about yay big, that have some bandaging and some Band-Aids and have some alcohol swabs, those sorts of things, right? Maybe even some gloves because you're dealing with some blood products. And I didn't mention that. Make sure you have sharps containers, right? Like, you need, every time you check your sugar, it's with a sharp, right? And that's a needle. Okay, you stick yourself, again, it's not such a big deal. It's your own blood, but you don't want anyone else to get stuck. So make sure that you have a sharps container as part of your kit. And they make little tiny ones. And it can be something as small as like a little tiny cardboard box, just as a temporary get to somewhere else where they have a bigger sharps container. But that's something you have to consider in both the needle from the syringe. And the thing about insulin needles is oftentimes the syringe is attached to the needle. They don't come off. And so you need to have something that's going to handle the whole syringe, as well as your little lancets to check your blood sugar. We have a really big kit, but I'm a physician and I should have that. And 90% of the people wouldn't know how to use my kit. But I was kind of laughing. Mine's the size of a great big backpack. But you want to have something you're familiar with. The other thing, as a diabetic, I think I would include in any kit would be a little topical antibiotic ointment, so that if you're hot and sweaty and you're trudging through hurricane waters, or you're out in the snow and you get scraped up, or whatever you're doing and you can't get somewhere right away, putting a little topical antibiotic ointment is probably not a bad thing either. Or if it starts to get red and icky, having those things available to you.
So much to think about. Thank you. Thank you. Thank you. So as I'm looking at this, I love your lists. I think the lists are huge in making sure that we're not forgetting anything. Pre-packaging what we can, making sure that that kit has what you can already put in it. And then those lists to make sure that by the time we get out of the door, we're going to have what we need, because it's not like it's easy to turn around and come back and get something during a crisis. And if you already have it at home, that means that if you have to shelter in place, you've got it too.
Yes. And I, listen, we're talking about diabetes, and we've talked about before that diabetes affects 11% of the world's population. So this is a very prevalent disease. Everyone and their mother has diabetes. Like, everyone knows someone that has diabetes. But there are other disease processes. There are other issues that some of those need refrigeration too, or not. But I think that everything we have said can be applied to any scenario where you have a medical condition. Maybe you have to have oxygen containers. Maybe your medicine just needs to be refrigerated. During the last hurricane, my aunt needed to keep some of her medicine for her migraines in a fridge. And so we had power. And so she brought them to me. But people on oxygen have concerns too. Whatever your medical problem is, it behooves you to sit down and think this through and say, okay, what if I have to leave very quickly? What if you're going through concerns for a fire and you have an oxygen container? I mean, like, that's a flammable substance. So you need to think, and one thing we haven't talked about, and I need to put this out there, is think about what your particular medical history is and what you need, and having extra of your medications and all those things. But also remember, you need a little more time. Like, I think about it, it's like, does anybody need to board the plane first kind of phenomena towards preparedness, right? So, like, if you are going to need to be somewhere where there's a pharmacy that's going to have power, you need to be thinking early. Maybe I need to go sooner rather than later. Or what's going to be available. Like this isn't just about stuff. Stuff is great, and you need stuff as a diabetic, but a lot of it is about preparedness in thinking. Okay, and maybe it's not you. Look, mom's a diabetic. She's on the other side of town. I'm going to have to go get her. Look, somebody call the pharmacy and make sure that we can have a couple days worth of supplies ahead of time. And let's take her to Uncle Jim's house because he's 50 miles away and it's not going to get affected there. And we can just know that we don't have to. It's about thinking about things, not just in lists, because lists are fantastic, but also when you see that disaster coming, thinking sooner is better than later. And that's not always true for everybody in every disaster. But when you start to get into medical processes, I'll never forget, I was working during Hurricane Charlie. I was working in the ER. And during that hurricane, we were in the middle of the state, and there were 4 hurricanes back to back, but Charlie was the first one. And Charlie was this massive windstorm. I mean, it took out power, it took out everything. And I could tell you some really horrible stories, but we're not going to do that. What I do remember, though, is all of these people lost power. And we have an entire section of the ER that we basically put a bunch of chairs in and just brought in oxygen tanks for people to breathe oxygen because they couldn't get oxygen at home, right? Like their machinery depended on power. And it wasn't that they were having a medical crisis. Like they were fine, but they couldn't use their oxygen. And so if you're one of those people, if you're going to have a need, go early, think ahead. There are shelters that open that will provide these things to you. And power, when it comes to medical neediness, and I don't care if you're 9, 14, or 90, a lot of times what you simply need is power. And you need to think ahead to where you can go, and maybe a couple of places that you can go. We've shared this story before that we evacuated halfway across the state to get away from the hurricane, only to lose power there too. And so you need to sort of have this staged planning. And again, we're not talking about end of the world crises. Like we're not talking about those kind of things that people talk about nebulously that maybe will never happen. We're talking about things that we've really lived through. And this is stuff that happens frequently. Can I tell you how many times I've evacuated for hurricanes? Like this happens all the time. I would encourage people to just say, okay, what are the most common things I'm going to have to deal with? What's my first plan? What's my second plan? What's my third plan? And when you've got that stuff covered, then think, okay, well, what if something different happened? What if now we are out of power for a longer period of time? What if the pharmacy doesn't open for days? And all of those things, what's the next step? But you can't prepare for the end when you first start. It's overwhelming. Like trying to get through your day as a diabetic, sometimes it's too much. So prepare for the day, prepare for the week, prepare for those scenarios that you can tangibly deal with. And when you've got the systems in place to deal with that without stressing, then add the next piece and the next piece. And you'll wake up one day a few years into this and realize you've done, like you guys have done, sort of the everything maneuver, but you've done it comfortably and you haven't broken the bank, and you've done it with a lot of education along the way.
Yeah, we like that to be small, steady steps. And you just keep taking those steps and you keep getting better and doing better and learning more. And that's part of this process.
Yeah. Thank you so much, Dr. Shamas.
Thank you.
Is there any last parting words that you have for our audience?
I'm trying to think if we've left anything out. One thing I didn't touch on, and I want to do it in this broader diabetic piece. This actually applies in some ways more to the type 2 diabetics who are often older, who have had other problems with their diabetes. Kids are different. Kids, their kidneys are still working, their feet still feel everything just fine. They're young, but insulin's key, right? But as you get older with diabetes, especially if you're type 2, you may have other health problems. You may have heart problems, you may have kidney problems, you may need dialysis. But on the simplest level, you may not feel your feet anymore, or at least not well, all right? Why is this a big deal? Well, if you are out walking through a hazardous environment, whether it's hurricanes, snow, fire, maybe your shoes aren't the best, maybe you're wearing shoes that are too tight and they're rubbing, like you're doing a lot of things you're not used to doing. I would say that part of the diabetic toolkit needs to be making sure you're doing good foot care, because a small wound on a foot in a diabetic, especially an older diabetic, you can lose your foot. So this is a big deal. So take a moment, couple times a day when you're out trudging through listen, we've had to walk out through floodwaters. I mean, like all of these things. Stop and look at your feet. And if you can't see really well, because again, this goes with slightly older populations, have someone else look at your feet, but it needs to happen a couple times a day, because you can have a very significant cut and not feel it at all. This is part of the neuropathy that goes with diabetes. So that's where your first aid kit comes in. That's where awareness of checking your feet comes in. It's sort of the opposite end of the spectrum of what we've been talking about with the insulin dependent diabetics, but good foot care. And then for those patients as well and their complications, thinking about things like, are you going to be able to make it to your dialysis? Those are the things that they should be aware of as well. And it all comes down to planning.
Great advice. I have a physician friend of mine who said, you need to, when we talk about like Armageddon medicine, you need to have enough shoes to last the rest of your life. And her point was very much because feet injuries or foot injuries can be deadly. So.
Yes, they very much can, but that's, the preparedness mindset. So let's all go down and get lots of shoes. It's all good.
Thank you so much, Dr. Shamas. We just really appreciate you. And if you haven't seen the first 2 videos, make sure that you go back and check them out, because there's some great information in them.
Thank you. Thank you very much. You guys have been wonderful to work with. I've really appreciated getting to touch base with you both, and it's been a lot of fun.
Oh, thanks.
Thank you. And for us also.
And for our question of the day, what experiences can you share with us to help us learn more and to be ready for the challenges ahead? Because we have all these different experiences, right? And it would be nice to be able to plan for some of the experiences that our audience has had, so we'd be ready before they happen. So comment below. And thanks for being part of the solution.